Hi, hello, welcome to my channel Mother Talks. Today our topic is communicable diseases. In this video, I am going to tell about communicable diseases. First we have to learn about what is the communicable period. The communicable period is the time period required for transmission of infectious agent from reservoir to a suspectable host, and the communicable diseases controlled by improvement of personal hygiene or improvement of social hygiene, awareness about health and awareness about the particular diseases or either communicable diseases. In this video I am going to tell about these 6 diseases. First one is tuberculosis. The tuberculosis is the most important specific communicable disease in world, mainly in developing countries. Specific infectious diseases primarily affected the lungs. It also affects all other vital organs like intestine, brain, bones, joints, lymph glands, skin, and etc. The causative agent of tuberculosis is Mycobacterium tuberculosis. Predisposing factors of tuberculosis is overcrowded population, malnutrition, poverty, alcoholism, drug addiction, and HIV infection, etc. Mode of transmission of tuberculosis is mainly spread by droplets infection produced by sputum of positive patient. Next one, coughing, and the note is not spread by formats, means the plates, spoons, and all etc. Signs and symptoms of tuberculosis are tiredness, loss of appetite, loss of weight, anemia, evening rise in temperature, sitting especially during sleep, cough for long time. Investigation mainly by sputum examination, chest x-ray, and Montauk's test. Incubation period of tuberculosis is varies from 2 to 12 weeks. Prevention: take all of your medicines as they are prescribed until your doctor takes you off them. Means whatever the doctor suggested medicines, they all should be used while the doctor says that these are the medication time is enough. The next point is keep all your doctor appointments. Always cover your mouth with a tissue when you cough or sneeze. Wash your hands after coughing or sneezing. Don't visit other people and don't invite them to visit you. Tuberculosis, this is the picture. What is tuberculosis is seen in just in a one picture. This is the tuberculosis infected person lungs. The symptoms of tuberculosis patient is fatigue, malaria, anorexia, and weight loss. Chronic cough is productive, and night sweats, hemoptysis, advanced state, low grade temperature, late afternoon. Treatment: TB medication 6 to 12 months, bed rest until symptoms rest, isolation until negative sputum, frequently output basis. Diagnostic: TB skin test, chest x-ray, bacteriological sputum studies. The next disease is chickenpox. The causative agent for chickenpox is a highly contagious disease caused by the varicella zoster virus. Incubation period for chickenpox is the incubation period varies from 14 to 16 days. The predisposing factors of chickenpox: newborns, infants whose mother never had chickenpox of the vaccine, adults, adolescents, and adults, pregnant women who haven't had chickenpox, people who smoke, and people who is immune system or weak by medication such as chemotherapy or by a disease such as cancer or HIV. And mode of transmission of chickenpox is transmitted from person to person by directly touching the blisters, saliva, for mucus of an infected person. The viruses can also be transmitted through the air by coughing and sneezing. Signs and symptoms: skin, blister, scab, ulcers or red spots, whole body, fatigue, fever, loss of appetite, and also common in Common symptoms are headache, itching, sore throat, or swollen lymph nodes. Prevention for chickenpox. The best way to prevent chickenpox is to get the chickenpox vaccine. Everyone, including children, adolescents, and adults, should get 2 doses of chickenpox vaccine if they have never had chickenpox or were never vaccinated. Chickenpox vaccine is very safe and effective at preventing the disease. These are the hard crust blisters and the red spots. Chickenpox is caused by the varicella zoster virus. The third one is measles. The causative agent for measles is an acute infection caused by the rubella virus. It is highly contagious and usually seen in children. The measles virus belongs to the genus Morbillivirus to the family Paramyroviridaceae. Incubation period of measles is varies from 10 to 12 days. Risk factors of measles being unvaccinated. If you haven't received the vaccine for measles, traveling internationally, having a vitamin A deficiency. Mode of transmission for measles: the virus is transmitted by direct contact with infectious droplets or by airborne spread when an infected person breathes, coughs, or sneezes. Signs and symptoms: dry cough and runny nose, body pains and headache, sore throat, watering and swelling in eyes, discomfort and fatigue, loss of appetite, diarrhea, light sensitivity, inflammation in lymph nodes, and Koplik spots means blue and red spots in the mouth. Prevention for measles: you can avoid catching measles by having the measles, mumps, and rubella virus. If the MMR vaccine is not suitable for you, a treatment called human normal immunoglobulin can be used if you are at immediate risk of catching measles. This is the picture. What are the symptoms of measles is fever, red blotches, rash first appear on the forehead, red inflamed eyes, runny nose, itching cough, hatching cough, and sore throat. Koplik spots means blue and red spots in the mouth. This is the measles virus. And what are the complications of measles or pneumonia? Severe diarrhea, blindness, ear infections, encephalitis. The fourth one we are talking in this video is influenza. Causative agent for influenza is caused by infection of the respiratory tract with influenza virus, RNA virus of the orthomyxovirus genus. Incubation period for influenza, incubation period varies from 2 to 4 days. Risk factors for influenza is chronic lung disease such as asthma and chronic obstructive pulmonary diseases, heart diseases, chronic kidney disease, diabetics or other chronic metabolic disorder, severe anemia. Signs and symptoms in plain area in the muscles: cough can be dry or with phlegm. Whole body chills, dehydration, fatigue, fever, flushing, loss of appetite, body ache or sweating, nasal congestion, runny nose for sneezing. Also common symptoms for influenza is nausea, shortness of breath, sore throat, or swollen lymph nodes. Mode of transmission for influenza is person to person. People with luke and spread it to others up to about 6 feet away. Most experts think that flu virus spread mainly by droplets made when people with flu coughs, sneezes, or talks. Prevention for influenza: avoid close contact. Stay home when you are sick. Cover your mouth and nose clean. Clean your hands properly. Avoid touching your eyes, nose, or mouth, same like COVID-19. Practice other good health habits. Types of influenza: there are 4 types of influenza: the influenza A, influenza B, influenza C, and influenza D. This is the picture. If the infected person of influenza can be talked with a person who is not affected by the infected droplets, aerosols, or formalin, the not infected person also be infected by the infected person droplets. The next one is diphtheria. Causative agent is diphtheria is an infectious disease caused by the bacterial microorganisms known as Corynebacterium diphtheria. Incubation period varies from 2 to 5 days for 1 to 10 days. The risk factors of diphtheria is lack of immunization, history of contact with a diphtheria patient, presence of skin lesions, presence of eczema, history of chronic health conditions, overcrowded. Mode of transmission for diphtheria. Diphtheria bacteria usually spread from person to person through respiratory droplets like from coughing or sneezing. Diphtheria is a serious infection caused by strains of bacteria called Corynebacterium diphtheria that makes a toxin. It is the toxin that can cause people to get very sick. Signs and symptoms: whole body chills, fatigue, fever, and respiratory, noise, breathing or shortness of breath, skin rashes or ulcers, speech, hoarseness or impaired voice, throat, difficulty swallowing or soreness, also common, cough, muscle weakness, runny nose, swelling or swollen lymph nodes. Prevention for diphtheria. Keeping up to date with recommended vaccines is the best way to prevent diphtheria. Treatment for diphtheria is treatment include antibiotics and an antitoxin that neutralizes the diphtheria toxin. This is the this is the way the diphtheria will spread to the person. The next one is whooping cough. Causative agent for whooping cough is pertussis, a respiratory illness commonly known as whooping cough. Is a very contagious disease caused by a type of bacteria called Bordetella pertussis. Incubation period for whooping cough is incubation period varies from 7 to 10 days for 4 to 21 days. Risk factors: unprotected young infants are at highest risk of severe pertussis, but older children, adolescents, and adults may also contract the disease if they are not fully immunized. Mode of transmission: people with pertussis is usually spread the disease to another person by coughing or sneezing, or when spending a lot of time near one another where you share. Many babies who got pertussis are infected by older siblings, parents, or caregivers might not even know they have the disease. Signs and symptoms of whooping cough is cough can be chronic or severe, nasal, congestion, runny nose or sneezing, whole body, fatigue or fever. Prevention for whooping cough: the best way to prevent pertussis among babies, children, teens, pregnant women and adults is to get vaccinated. Also keep babies and other people at high risk for pertussis complication away from infected person. This is the picture where the whooping cough is infected to other person. Thank you. Please subscribe to my channel for more updates and more videos.